Have you ever felt a strange sensation, a sudden pain, a wave of unexpected fatigue and just brushed it off as nothing? But what if that feeling isn't just discomfort, but your body's desperate warning that something dangerous is happening inside you? Today, we're going to reveal 6 dangerous symptoms that doctors warn you should never ignore after the age of 60. And stay with me until the end of this video because knowing these warning signs could quite literally save your life or the life of someone you love. Let's get started. There's a big difference between feeling tired after a long day and experiencing exhaustion. You wake up after a full night's sleep, but instead of feeling refreshed, your body feels heavy, as if you've been dragging a punching bag all day. Even simple things like getting dressed, cooking breakfast, or chatting with friends can feel overwhelming. Maybe you used to love going for a morning walk, but now, after just a few steps, you're gasping for air as if you've just climbed a mountain. This is exhaustion, and it won't go away with a nap or a cup of coffee. Doctors say this type of fatigue is a sign that your organs may be struggling. Your heart may not be pumping blood as well as it should, or your kidneys may be failing. In some cases, it's an early warning sign of advanced cancer or another life-threatening condition. This excessive fatigue occurs when your body has to use all its resources to maintain basic functions. This is not normal and is not something to ignore. The most important clue is when this fatigue comes on suddenly or gets worse over time. If you used to feel strong but now feel weak and exhausted for no apparent reason, it is time to worry. Your body is warning you that something deeper is wrong. So what should you do? Pay attention to when this fatigue started. Ask yourself, what makes it worse? What makes it better? And most importantly, if this exhaustion is affecting your daily life, don't ignore it. See your doctor. The sooner you act, the better your chances of identifying the cause and taking control of your health. Comment number 6 below if you are determined to watch every little change in your body for a longer, healthier life. Next up is a symptom that can strike and put your life in immediate danger. I'll explain what it is and what to do if it happens to you. Stay tuned. There is one sensation that you should never ignore. A feeling of crushing pressure, squeezing, or intense tightness in your chest. If this happens suddenly, especially if the pain spreads to your arm, neck, jaw, or back, you could be just seconds away from disaster. Doctors warn that this type of chest pain is often a sign of a life-threatening condition, such as a heart attack or an aortic aneurysm. A heart attack often begins with mild discomfort, just a slight tightness in the chest or upper body. It may also be accompanied by nausea, dizziness, or cold sweats. This is why so many people overlook it. But waiting, even for a short time, can cost you your life. A report from the American Heart Association warns that these silent heart attacks are more common than you might think. And they are especially dangerous because people often postpone treatment until it's too late. And if the pain is sharp, stabbing, or like something is tearing apart inside your chest, that's even more alarming. This is a major warning sign of an aortic dissection, one of the most dangerous medical emergencies. According to the Cleveland Clinic, an aortic dissection has a 50% fatality rate within the first 48 hours if left untreated. Emergency surgery is the only way to survive. If you suddenly experience severe chest pain, do not lie down and hope it passes. Do not convince yourself that it is just stress, and do not risk waiting. Call emergency services immediately, because when you have chest pain, every minute counts. If you found this helpful, leave a comment below and type the number 3 to let me know you're here. And get ready, because next up is a subtle yet deadly symptom, and one you should never ignore. Think about it. You are sitting in a chair, not exerting yourself too much, but suddenly you feel like you can't breathe. You take a deep breath, but it's still not enough. It's as if you're gasping for air through a straw, no matter how hard you try to fill your lungs. This isn't just discomfort, it's a serious warning sign. Doctors warn that unexplained shortness of breath is often your body's way of signaling that something serious is happening inside you. And here's why. Pulmonary embolism, one of the leading causes of sudden shortness of breath, happens when a blood clot travels to your lungs. It can strike without warning, especially if you've been sitting for long periods or have recently had surgery. At first, you may feel a slight tightness in your chest, but within a short while, it can take your breath away. Congestive heart failure is another common cause, particularly in older adults. This occurs when your heart isn't pumping blood properly, causing fluid to build up in your lungs. It often starts as mild shortness of breath during simple activities, but over time, it gets worse. Some people even wake up in the middle of the night gasping for air. And then there are silent heart attacks. Unlike the intense chest pain you might expect, some heart attacks show up as shortness of breath combined with nausea, cold sweats, or extreme fatigue. Many people don't even realize they're having a heart attack until it's too late. According to the American Heart Association, silent heart attacks account for nearly 45% of all heart attacks and are more common in older adults, particularly those with conditions like diabetes or high blood pressure. So, what should you do if you experience unexplained shortness of breath? Stop what you're doing, sit down, stay calm, and call emergency services immediately. Don't wait, don't assume it will pass. Whether it's a blood clot, heart disease, or a serious lung issue, acting quickly could save your life. Next comes another warning sign that's just as dangerous, and ignoring it can be fatal. But before we get into that, I have a quick 10-second request for everyone listening. If you can support me in any way, please tap the notification bell and hit the subscribe button. It means a great deal. It helps this channel tremendously. And if you do that for me, I promise my team and I will do everything we can to make this program even better for you. Do we have a deal? Losing weight without trying is not just unusual. It's a sign that something serious may be happening inside your body. Your body may be burning through its energy reserves not because you're more active or eating healthier, but because it's fighting off something far more dangerous. Doctors warn that unintentional weight loss, especially in older adults, can be an early sign of a serious medical condition. Certain types of cancer, particularly pancreatic cancer, lung cancer, or cancers in the digestive system, are known to cause unexplained weight loss long before other symptoms appear. This happens because cancer can change the way your body processes energy, causing it to burn calories at an alarming rate. But it's not just cancer. Uncontrolled diabetes can cause your body to burn fat and muscle for energy, leading to sudden weight loss even if your eating habits haven't changed. Sudden weight loss can also be a sign of heart failure. In some cases, advanced heart failure can prevent your body from properly absorbing nutrients, causing your muscles and fat stores to shrink over time. This may leave you feeling weaker, more fatigued, and increasingly frail. Chronic conditions such as tuberculosis, long-term infections, or autoimmune diseases can push your immune system into overdrive. When this happens, your body may burn extra energy just to keep your immune system functioning, resulting in significant weight loss. So, how much weight loss is too much? Health experts warn that losing 5% or more of your body weight within a short period without trying is a serious red flag. If you find your clothes are looser, if you have to tighten your belt a little more, or if people keep saying you look thinner and you haven't changed your diet or exercise routine, don't ignore it. Schedule a checkup. Get a blood test and ask your doctor to find out what's going on. Don't assume it's just part of aging. The sooner you act, the better your chances of catching a serious problem before it's too late. So if you're still watching and found this valuable, leave your mark on this video. Comment your location so I know where we're connecting from. And get ready, because next up, we're going to talk about another warning sign that's even easier to ignore. Doctors warn that sudden confusion, disorientation, or personality changes can be life-threatening warning signs. This is often the brain's way of signaling that something is really wrong, and waiting to see if it improves can be a fatal mistake. For example, a stroke can cut off blood flow to parts of the brain, starving those areas of oxygen. This can cause a range of symptoms, including sudden confusion, slurred speech, or difficulty recognizing familiar people and places. But some people experience a brief episode where they seem unusual, and then, a few minutes or hours later, they are completely fine. This could be a transient ischemic attack or mini-stroke, and it is a warning sign that a larger stroke may be coming. Another concern is that conditions such as meningitis or encephalitis can cause sudden disorientation, especially in older people. A seemingly simple infection like a urinary tract infection or pneumonia can progress to a serious brain-related condition called delirium. This can cause a person to appear restless, distant, or unable to concentrate. In fact, according to Johns Hopkins Medicine, older adults with infections may suddenly experience confusion or hallucinations, often without a fever or other typical signs of illness. And then there's the possibility of Alzheimer's disease or other forms of dementia. While Alzheimer's usually progresses slowly, some people experience sudden mental decline, forgetting recent events, losing track of time, or struggling with familiar tasks at once. One of the biggest mistakes people make is assuming that sudden confusion is just part of aging. It's not. These abrupt mental changes are often the body's way of warning you that something far more serious is happening inside the brain. So, if you or someone you love suddenly seems confused, forgetful, or starts acting strangely without explanation, don't ignore it. Call emergency services immediately. Whether it's a stroke, an infection, or another serious condition, acting quickly can make the difference between recovery and permanent brain damage. Up next is another warning sign that's often mistaken for something harmless, but it can become dangerous in just a matter of minutes. Stay tuned. Severe and persistent abdominal pain is not something to ignore, especially if it appears suddenly or doesn't improve. Doctors warn that this type of pain could be your body's way of signaling a life-threatening emergency. An abdominal aortic aneurysm rupture is one of the most dangerous causes of intense abdominal pain. An abdominal aortic aneurysm occurs when a weak spot in your aorta, the largest artery in your body, starts to bulge like a balloon. If that weak spot bursts, it can cause massive internal bleeding. And without emergency surgery, it is often fatal. The pain is often described as a deep, throbbing sensation that can spread to your lower back or sides. Some people describe it as sharp, intense pain that worsens with each heartbeat. Another serious cause of abdominal pain is an intestinal blockage or restricted blood flow to the digestive system. This can occur due to twisted intestines, a dangerous blood clot, or even advanced stage cancer. In these cases, the pain may feel sharp and cramp-like. Your abdomen may become swollen, firm, or tender to the touch. If you haven't had a normal bowel movement for some time, this is a warning sign that something serious could be happening. Pancreatitis can cause severe burning pain in the upper abdomen, sometimes spreading to the back. This pain may worsen after eating, making even simple meals uncomfortable. Without treatment, pancreatitis can lead to dangerous complications like organ failure. Sharp pain beneath your ribs, often triggered by fatty foods, could be a sign of a gallbladder attack. Many people mistake this for acid reflux or indigestion, but if your gallbladder becomes inflamed or blocked by gallstones, it can quickly lead to a life-threatening infection. If you experience severe, unexplained abdominal pain, especially if it spreads to your back or worsens with movement, seek medical help immediately. Certain conditions may require emergency surgery. Delaying care can mean the difference between recovery and a far worse outcome. So, if you're still watching and found this information valuable, comment the number 4 below to let me know you're here. If you've made it this far, you've understood something incredibly important. Your body doesn't whisper when something is wrong. It warns you loud and clear. Ignoring these symptoms or assuming they'll go away on their own could be a deadly mistake. But the good news is that by recognizing these warning signs early, you can take action before a minor issue turns into a life-threatening emergency. So remember this: don't ignore sudden fatigue. Don't ignore chest pain. Don't ignore unexplained weight loss, shortness of breath, or sudden confusion. These are not just signs of normal aging. They are signals, and your body is counting on you to pay attention. Now, I'd really love to hear from you. Have you or someone you know ever experienced one of these warning signs? What did you do about it? By sharing your story in the comments, you can help others recognize the symptoms before it's too late. Your experience could save a life. If you found today's video interesting, don't hesitate to hit the like button and subscribe to my channel. Your support is very important to us. Be sure to check out the next video appearing on your screen. You're sure to love the content we bring. Please leave a comment about which country you'd like us to explore next. Thank you for watching, and see you in the latest video.